Hi, I'm Oriana, and I'm here with MoodStreamer, an application for automatic mood journaling and improving mental health. I'm here with my partner, Sid, and we're both PhD students here at UC Berkeley. I'm in the Department of Computer Science, and Sid is in Civil Engineering. So we were thinking about how we can use computer science to improve mental health care. And one problem that we thought about was that there's very little data that's collected currently on patients. Now, we've decided to focus on mood disorders because mood disorders are a huge problem. Over 20 million Americans suffer from mood disorders every year. This is a continuing problem that lasts through their entire life, and it results in mood disorders being the leading cause for disability in the United States. This is a huge economic burden of over $40 billion. So the way these are currently treated is people go to mental health care providers, such as a psychiatrist or a psychologist, and they talk to them. And the psychiatrist or psychologist asks them, how are you feeling? Right? But they only see them once every so often, so we get very little data. And they only see their provider maximum once a week. Right? So we wanted to take these data points that you get very few data points on somebody, and we want to give you more data so that you can see better, you can better monitor how the patient is doing and track whether they're being responsive to the medication, whether they're in the correct dosage of medication, or whether it's stopped working. So there's lots of applications that try to look at how to improve the situation, and all of them on the market just ping you with a survey. And this is very annoying, and so there's very low compliance rates with this, especially within this population, which already is known for poor compliance. So we would like to introduce MoodStreamer. This is an application for automatic mood journaling. It works by mining your SMS behavior and extracting what your mood is. It uses methods similar to Twitter to predict what your mood is and to track this. It then provides you with data that shows you how well you've been doing, and you're able to provide this to your medical professional, and so that you can enrich the conversation and you can have a better discussion about how well you've been doing. Instead of just asking how well are you doing today, how do you think you've been feeling over the past month today, you can actually see data about how well you've been doing. So we started in January building our app, and we started with this competition. Today we're pitching, and this summer we'd like to hold a pilot study at UC Berkeley where we're going to test with students. We've talked to a lot of people and found out that this might be possible, and so this is our current plan for the summer. We'd like to continue developing through the fall and have a larger study in January. So with that, I conclude, and we want to build this app to help as many people as possible and improve mental health care. Thank you.
Thanks for your presentation. Very interesting, and obviously a real need out there. Does this completely replace surveys and other interactive forms, or does it supplement them?
We're not about replacing a medical professional. We're about supplementing them. So we see this as supplemental, right? When you go into your professional, they will ask you, how are you doing? And there will be a discussion. But this will provide supplemental information, especially, I don't know if you're familiar with bipolar disorder, but this is a cyclic disorder, and people will actually cycle. And it will be a very quick cycling. And, you don't have the best comprehension about, how many times did I cycle in the last month? So we're hoping that we can provide some more quantitative data on this so it can supplement surveys. And our app will be, when it's downloaded, you will initially have to answer a few surveys so we can kind of train the models. But it won't continue to ping you constantly, which is what all the apps on the market currently do.
So it will detect mood solely through analyzing the narrative content of SMS?
The SMS behavior. So we'll look at the content of the SMS as well as other data that's collected on the phone. And we're looking at incorporating other data such as spatial data and temporal and all kinds of things.
Great idea. I think it's got great social value and impact. I guess one thing maybe you can share with last question that Larry had. How do you know that? How do you confirm? Do you have any special patentable ideas about converting the mood swings or what someone sends in SMS to something that quantifiable? Because even if you go into wherever your therapist and share that,
yeah,
they're going to question again, this being, anything in the medical, you have to be able to say, okay, you have something concrete that says,
Of course.
this has been verified, or can you share a little bit more in terms of research, or
Of course.
what's something that you have that you can either, get into something more specific or something unique that you have or you can potentially develop? Yeah.
Okay, so currently the gold standard is surveys, right? You ask a patient, how are you feeling, and that's what we use. People are looking at like biometrics and stuff like that. Right now, we're not there. So what our gold standard will be is our surveys, and in our pilot studies to prove that we're working, we will have to bother the patients or the people that are participating in the study with surveys and prove that we can get at least that accuracy. So for our pilot study, we hope, right, we're all about research as PhD students. And so we're hoping to be able to validate that very concretely by showing that we can reproduce that data without user input.
And I'd like to add in on that. We have been working with researchers in psychology to develop models, so biophysical or neurobiological models to help assist the prediction.
Because, somebody could be, if they're not in a good mood, they'll just take their phone and throw it away, or, just shut down the phone. Then if you're solely relying on SMS or messages, then, that may not be concrete enough, right?
So, I'm sorry. Right. So we don't solely rely on the content of the SMS message. We also look at the behavior, right? So when people are depressed, a lot of times they shut down and they stop interacting with their environment. And one sign of this could be that you stop texting, right? Or some people, when they feel blue, maybe they start texting their friends or their family or whatever. Other people, when they're severely depressed, they'll just shut down. We can see that as a signal, and we can mine that as a signal. So we're in the process of validating concretely our results and showing and really solidly proving that the data that we extract and present to you is 100% valid.
Yeah. My suggestion would be work on that piece in terms of, all the different elements, because I think that is the unique value proposition that you can bring in.
This is what we're doing this summer.
Yeah. Cool. Great stuff.
In your conversations with therapists, is there a willingness to pay? Are they going to pay per user per month, or what type of monetization opportunities have you thought about?
So we've thought about quite a few, and we're still considering what the best option would be. I think that we're coming from this as empowering our users and our patients. And so right now, I think that we would monetize based on people buying the app. We have considered like partnering with Kaiser, right? They're all about wellness and tracking how well you're doing to continue to keep health. And so we might partner with somebody like Kaiser and sell it to them, and then they could provide it to their patients, and they would have like a license. So we're open to both models. We also see a very big opportunity in drug studies, because currently drug studies like lithium is a very significant drug, and the way it's approved is like an 8-week study, right? It takes 6 weeks to kick in. So if we could provide a tool that is passively monitoring, you could really see how a patient is doing over a long period, and then we see, big pharma maybe coming in and buying the app to be able to prove quantitatively that their medication is working over a much longer time period than they're currently able to show.
Scale 1 to 10, where are you in terms of refining the model, right? Sort of your correlation model, and are you halfway there, you think, or are you still in the early stages?
90% of the work comes in the last 10%.
Okay.
So what I could tell you something, but it might be. We have models working, and we have a variety of different methods going. We find that so we're very excited about these results because we think that there's really interesting questions that we're going to be able to answer. One is that there's multiple dimensions to your mood, and we're finding that it's easier to predict some than others. Our prediction rates are not currently satisfactory, but others we have up to 90% prediction accuracy. Now, we need to expand to more people, we need to expand to more data, longer term, more dimensions of your mood, but we do think that this is possible.
Where are you, 6 months, 1 year, 10 years away? Because some of these things can go on.
We're aiming for July. Summer classes, we want to do it.
Just a quick follow-up on that.
Yeah.
I'm wondering, it'll be something you find in your research about the variability across subjects. As I can imagine, some of them shut down, whereas some of them reach out, and so it may not be consistent.
That's why we're really excited. So one thing I didn't say is that all the data is kept on the phone, so it's entirely private, but The beauty of that is that it's tailored, right? We're all about personalized medicine. So if you shut down, our app should be able to find out that that's how you manifest your depression. If you reach out to people, then it's up to the provider to decide, oh, maybe you're not severely depressed, but our app will be able to say that's what your depression looks like.
All right, well, thank you.